Hey, hello, everybody. I'm sorry for the previous link. I did something on my microphone and I don't know what happened. And when I changed my microphone here from place, it probably disconnected. So here we are. And I hope you can connect to this live here. I know we had almost 227 people in the previous one. And I don't know why I disconnected, but anyways, I'm learning how to do that. I hope you can connect here and we'll restart this live here. So let me know if you can connect. Here we have 38 people here already. People are smart. They're finding their way to reconnect. Good. So I'm sorry about that for the previous problem. Now I hope you can hear me well now. Hi, Kamal. How are you? Can you just give me some feedback if my sound is going? Yeah, I hear you now. Thank you, Shad. Good morning, Joanne. Good morning, Shad. Frankie. Thank you. Yes, wonderful. So let's just wait for people to join and then we can discuss. I was going to talk about, today I hope I can talk about central sensitivity syndromes. These are things that happen when a person has fibromyalgia, a person has chronic fatigue syndrome, or post-viral conditions like post-COVID, post-infections, and this is what I'd like to talk today. So write your questions regarding this pain associated with serious tissue damage. Hi, Deep. How are you? Yeah, my thoughts. So if you have general questions, please ask them in the chat here. Remember that I do not give medical advice. I'm not able to provide you with specific medical advice. But if you have general questions, especially around central sensitization, central sensitivity syndromes, I am hoping that I can answer those questions here today. Also, please remember the rules of this chat is that please do not post any confidential or private information here. Like don't post your email or telephone number. Don't ask me specific questions about your case because I can't do this. I don't have all the information to give you an intelligent medical advice. When I give medical advice, I need to get a lot of information from the patients. I need to examine them, and I don't have the capacity here. Also, if you're going to reply to someone else on this chat, please be kind and use compassion because we are all here to learn. And even if you don't agree with what someone says in the chat, please be kind to them. And if anyone do not abide by these rules, I have chat moderators today, and they will be removing you from the chat today. I hope I don't need to do this with anyone. So welcome back. And so let's start. And I'd like to tell you too that I will have one tip to give to people at the, I hope I have time to give for people who have fatigue. Fatigue is different from being tired. Fatigue is a disease. Fatigue is it's what we call, it's a disease of the resting system, or we need to rest, we need to sleep, we need to take time. And when that system is not working properly, the person feels fatigue. And some people have chronic fatigue. And it's a different type of fatigue because it doesn't get better with rest. Like if I get tired because I did gardening and I did a lot of things around my house, I rest and I sleep for a few hours, I feel refreshed. But people who have chronic fatigue, they don't have that. They can't rest well. So these are people who are fatigued during the day and insomniacs during the night. This is very common in people who have central sensitivity syndromes like fibromyalgia, complex regional pain syndrome, even chronic migraines, chronic myofascial pain syndrome, and post-viral syndromes like post-COVID. So I want to give you some hints, and I have one tip that is very practical. I want to give this to you at the end. So let me see who is here. Can you tell me where are you coming from? Oh my God, I have Alfred. Thank you, Alfred. You are watching from Melbourne, Australia. Thank you so much. Oh my God, that's the other side of the globe. I feel honored about that. Where are you guys? Tell me, Toronto. Where else are you? So very close. Arizona. Oh wow. We have people from the United States. We have people from my own city here, Lake Ontario. It's a warm day today. We have blue skies and a sunny day, and I hope you can get some time outdoors. Hi, Jane. You are in your trailer. Jane Plenty gave an interview on my channel. If you had not had a chance to see her interview, please go and watch that video. I'll ask my moderators if you can find the video from Jane and post here the link for people to watch. She had 37 years of central sensitization syndromes, 37. And now you see, she's in her trailer in the lake, and she is living a life that she's making up for all the time that she lost. I will not touch this microphone again because I don't want to lose the sound again. So, so watch her video. Anyways, so if you have or if you had fibromyalgia, chronic fatigue syndrome, migraines, tension headaches, post-COVID, you may have questions about this. You may have questions about what is central sensitization, what's happening in your body, and sometimes it's very frustrating because you get tired with very minimal exposure to exercises, even like doing simple activities like they're part of your normal life, like doing the laundry or grocery shopping or gardening, or sometimes even, trying to do your hair, wash your hair, or doing the dishes, and the person gets very fatigued. So this is part of the central sensitization syndrome. And I talk about this in my book. So if you had not had a chance to see my book, I released a year ago, and I talk about central sensitization and I explain what it is. And I hope if you had not had a chance, you can buy this book, any bookstores where books are sold, Amazon. Here in Canada, you can buy on Indigo chapters, in small community bookstores, but Amazon all around the world. And I talk about this. I explain what is central sensitization, but here I'll give you a quick explanation. I also have a video. I know, JP, thank you for putting the link there. Jane, Giovanni put the link for Jane's interview. South Africa, oh my God, thank you so much. I see Maria Pestana from South Africa. So central sensitization is a biological condition. So the person is not imagining, it's not psychological. The person is a physiological condition that happens. And we now know a lot about what's happening in the body. Central sensitization starts in the spinal cord. Here it is. I have here the model for a spinal. This is the spine, the lumbar spine. You may have seen this model that I have in one of my videos of when I talk about spinal stenosis. But the spinal cord is the medulla that comes from the brain, and it's very fragile. So it is inside of the vertebra. These are the vertebrae of the lumbar spine. And so here in the spinal cord, inside of the vertebra, is where all the nerves of the body enter, bringing information about your body. And what happens is, in the spinal cord, there is a synapses there, and in this synapses can become abnormal. This synapses we call the central sensitization is a disease of that synapses, where the nerves are coming from the periphery, they're connecting with the nerves that will go to the brain. And at that point, that synapses can become abnormal. And that's where central sensitization starts, which means that synapses will amplify all the sensations that are coming from the body that carry the information about danger. So danger can be all kinds of things can be dangerous. I have a list here that I made for myself. So if there is a tissue damage, like a cut in the skin, a nerve that is compressed, that danger sensation will be amplified by central sensitization in the spinal cord, and it will arrive in the brain as pain. Sometimes, even after the injury has healed, there is no more information coming from the periphery because the cut in the skin is healed. Now it's only a scar. Like I had many, I have many scars here on my skin that I had cuts when I was a child, many of them. I had burns here. I had a big burn here in this area of my hand. I can see a scar here. There is a little bit of a scar here. So years after this burn happened, the spinal cord can still be amplifying and generating the sensations that will go to the brain. So here I have the brain. Look, this is the big brain, right? It's much bigger than the real brain. This is a model. So the sensations come here from the brain stem. So they enter, this is the brain stem here, this white part here is the brain stem, and they enter the brain. So I don't feel that pain from the burn here anymore, right? So it's gone. But when it was acute burn here in my hand, I had a lot of pain. So my spinal cord did not develop central sensitization for some reason. Therefore, today, I don't have sensations of that burn anymore. So what happens is, in some people, that abnormal spinal cord synapses will continue generating impulses and sending to the brain even after the original impulse has healed. That's what central sensitization is. So the person can have this abnormal synapses with any sensations of danger because the function of the brain is to protect us from danger. And so if the brain is receiving a lot of information from this synapses, this spinal cord synapses central sensitization, it will now become overwhelmed. So now imagine the brain is getting information from, that something is coming from the periphery, and the brain doesn't know that the injury has healed, has passed, has been treated. So this happens with viral infections. For example, any virus can cause, for example, this fatigue, because now these sensations coming to the brain will affect the concentration, the sleep. It will cause this fatigue. It will cause the sensations of pain, numbness, tingling. And the pain starts spreading all over the body. So that is when the person says, well, but my pain started in my shoulder, but now I feel the neck, the other shoulder, the lower back, my head hurts, my tummy hurts, my bladder hurts, everything hurts. It's because now the brain is overwhelmed. So that's what central sensitivity syndromes are. And the symptoms are pain, numbness, tingling, burning sensations, tiredness, poor concentration. And even sometimes the person will become sensitive to chemicals, food, noise, light, smells. Okay, so I think if you know someone with central sensitivity syndromes, please be aware that this is a real syndrome. They're not making up those symptoms. It's real. Their pain is real. They're not faking it. It's not psychological. And there is treatment for that. Okay, so Jane Plenty, who is here watching today with us, she showed in the video that I recorded with her that that's possible. You can watch her video. Yesterday, I recorded another video with a man who he had central sensitivity syndromes. He had more than 70 different symptoms, and now he is totally symptom-free. I hope I will release that video next week. So, and I'll tell you today one thing that you can do for that chronic fatigue. So let me just read the comments here. So Malaysia, hi, Nur Faiza from Malaysia. So there are some questions here. Low dose naltrexone. tendon inflammation, and you are from Brazil. Hi, Nat. Gertie from UK. Wow, amazing. We have people from many different parts of the world. That's great. So the central sensitization syndrome, let's talk a little bit about that. And if there is any doctor here listening to this live, and if you want to learn more about nociplastic pain, because the mechanism of this chronic pain caused by central sensitization is called nociplastic pain. There are three types of pain: nociceptive, neuropathic, nociplastic. If you are a doctor, a physiotherapist, a nurse, psychologist, a dentist, and you want to learn more about nociplastic pain, I have a course. And I'll ask my team here to put the link to my website where there is the link to the course. This is for healthcare professionals. And if you register to the course today, because you are attending this live session, I will give you a discount, 20% discount to my course. And the code, the coupon for you to get the 20% discount is livestream20. Can you please just put the coupon code in the chat here, so then people can, the doctors or nurses, they can take advantage of the 20%. Yes, livestream20 if you want to, because I realize a lot of my colleagues, doctors, physiotherapists, psychiatrists, sometimes surgeons, they have no idea what is central sensitization. Emergency doctors, and when these people with fibromyalgia or chronic fatigue or post-viral syndromes like post-COVID, when they show up in Emerge or with their family doctors, they don't know how to help these people. So I feel very frustrated because my colleagues don't know how to help them. And it's not their fault, it's because they didn't learn this in medical school or dentist school or nursing school. This is not taught in medical school. Can you believe that? We're trying to change that. So how to cure this? Yes, how to cure central sensitization? Shad, that's a very good question. The cure, I don't like to use the word cure because I like to use the word control or conquer or self-manage, because once you develop fibromyalgia or chronic fatigue syndrome, you may always have a relapse. So that those changes that happen in the spinal cord, in the brain, the brainstem, some of them are permanent. We know this because there are genetic changes. And once the genes change, it's kind of a, not that the genes don't change, but the genetic expression change. We can revert that. There are some things that we can revert. But I would say a person with fibromyalgia, chronic fatigue syndrome, and post-viral conditions, they may be paying attention because they may have some relapses in their life. But then they need to use the same strategies that they use to manage those symptoms, to get rid of those symptoms, like what Jane Plenty did. It will work again for the next relapse, okay? There are a lot of things that they can do. And again, if they want to know what are the things that help to control, to conquer chronic pain, that's why I wrote the book. The book has like the 8 steps, including sleep, including exercises, including diet, including taking care of yourself, doing brain retraining, thinking differently about your disease, and getting help from others. Sometimes we need to use medications, not always. Most of the time, I'm able to remove medications from people. Instead of giving them more medications, most of the time, what I do is I remove medications because they don't need that anymore. Yeah, so the third degree burns one have a question. So let me read the questions here, and then let me see how I can help you. New treatments for fibromyalgia. Gertie is saying fatigue is a big problem. So I hope my tip that I'll give to you in a few minutes will help you, Gertie, because I'll tell you what people with fatigue can do. Healing the nerves, Yeah, keep it hydrated. Yes, that's very good. Okay, so hi Vinesh. Vinesh is a physiotherapist in India, and oh my God, he's a very good. He also has a YouTube channel. If you are in India, you know he has excellent advice for people with chronic pain. He's an excellent physiotherapist. Thank you, Vinesh, for coming here to my live today. So let me see. I'm looking at my script here to see if I am not forgetting anything. So I told you if you are a doctor about my course. So if you register to my course today, nociplastic pain, you get a 20% discount using the coupon livestream20. And if you are a patient or caregiver with central sensitivity syndromes, I recommend you not to take the course because the course is very technical. You can take the course, but I don't think you will take, you will learn a lot because it's very technical. I'll talk about the science, the studies. I recommend you to get the book or watch my videos that I have on my channel. I have a video about central sensitization on my channel. I have a video about chronic fatigue syndrome on my channel that I talk about what is chronic fatigue syndrome. I have also a video about exercises for fibromyalgia. So before I tell you my tip about what is my tip for fatigue, the central sensitization, again, it's this amplification of the pain, the danger signal. So any danger signals that your body perceives as danger, central sensitization just amplifies them. So this could be amplifying pain, amplifying fatigue, amplifying depression, amplifying noises and light and smells. And so the person becomes sensitive to chemicals and food and a lot of things around them. So what happens is they start reducing the things that they do. Like they say, I cannot do this, I cannot do that, I cannot do this, I cannot. So they have a huge list of things that they cannot do. So the treatment for central sensitivity syndromes is to start exposing yourself to those things slowly, within some limit. Slowly exposing yourselves to doing those things. Make a list of all the things that you cannot do. Choose one, and let's start exposing your body. So it's an exposure therapy. It's the same way that we treat people who have fears. So if you know someone who has fear of spiders, I know a lot of people who have fears of spiders. If they want to get rid of the fear, you start exposing them to spiders, but a tiny spider, and then you start increasing the spider. There are people that they have fear of speaking in public, but they need to speak in public for their jobs, to get promoted at work. So they seek care. So they go to a psychologist and they say, I need to get rid of this fear. Otherwise, I'll never be promoted at work. So how the psychologist will help them to get rid of the fear of speaking in public? It is by exposure. So they will be exposed. You will be speaking to a group of two people, two very friendly people. And then you increase the number. Now you're going to speak in front of 5 people. Now you're going to speak in front of 10 people. And then one day they will be speaking in front of 500 people and they will not have that fear again. And that fear is real. When a person has fear of anything, and a lot of people have fear of moving because they have pain, or if they have chronic fatigue, they try to avoid doing physical activities. Why? Because they get fatigued, and it's a terrible fatigue, and it doesn't get better if you rest. So they say, what's going on with me? The treatment that we know is exposure. So that's my tip today. I'll teach you today how to do this exposure very, very slowly. Okay? Okay, so let's talk about the exposure. How do we do this? The exposure to physical activity in people who have fatigue has to start very small. I know some people who tell me they have fibromyalgia, they have chronic fatigue syndrome or post-COVID syndrome, and they say, even if I walk in a flat floor for 1 minute, I'm done. 1 minute, believe it or not. And these are people, they're not faking it. This is real, okay? This is real biological phenomenon. And these are people who were runners. Like they were runners a year ago, 2 years ago, they were able to run marathons, and now they can't walk 1 minute in a flat surface. This is how severe this fatigue can be. Okay. Not everybody with fibromyalgia will have this severe fatigue. Thanks God. Okay. But some people with fibromyalgia, they say they can't clean their house anymore. They get very fatigued, and then they have to rest the whole day. And then the day after, they are still tired and they don't sleep well at night. So what is the treatment for this? I don't know what is the name for this. I know people call this different names, this treatment, but this is what we recommend people to do. It's a gradual exposure to movement, and it has to be controlled by the heartbeats. So I'll teach you how you can monitor your heartbeat, your heart rate, because you need to do this activity within certain amount of your heartbeat. Why is that? People who have chronic fatigue or this severe fatigue, they have a problem with anaerobic metabolism. That's where the disease is, okay? Because of this central sensitivity syndrome, that the brain is super sensitized, they have neuroinflammation. There is neurogenic inflammation in many parts of the brain. We know that now. I have a video about that, neurogenic inflammation in the brain. So they have a problem with anaerobic exercises. What is anaerobic exercise and what is aerobic exercise? That's why if you watch my videos that I talk about exercise for fibromyalgia, I always talk about you need to do aerobic exercise. Don't do anaerobic exercise. So aerobic exercise is every chunk of exercise you are doing, you're using oxygen. If you start doing these exercises a little bit higher and your heart rate starts going up, is increasing, you enter a phase of anaerobic exercise that you don't have enough oxygen for your muscles, for your cells. So the cells continue exercising because you are doing exercise, you didn't stop, but there's not enough oxygen. So they enter a state of anaerobic that they use and they produce lactic acid. And this is not good for people who have fibromyalgia, central sensitivity syndromes. Okay, so that's my tip today. You need to do your exercises within that range of aerobic. How do you know if you are doing exercises within that range of aerobic exercise? The threshold, there is one point that your heartbeat, if you start increasing, you pass from aerobic to anaerobic. What is that point? So if you measure your heart rate right now, you know how to measure your heart rate? You don't need any fancy watch or any fancy straps. I know some people that they buy those chest straps that connect with their smartphone, or they have a smart watch that measures how many heartbeats they have. If you don't need to spend money with that, if you want, it's okay, but you don't need to. You just find your pulse here with these two fingers here. You find your pulse, and then you measure your heart rate, how many beats you have in 15 seconds. So stop your watch, put your watch for 15 seconds and measure how many beats. And then you multiply by 4, because 1 minute has 4 times 15 seconds, right? 15 plus 15 plus 15 plus 15 is 60 seconds. So mine, I just measured before, and it was like in 15 seconds, my heart was beating 20 times. So multiply by 4, it's 80. So this means that my heart rate, when I was here resting, probably when I had the problem with the sound of my life, that probably went to 120. But if I'm resting, not doing anything, my heart rate was 80. So how do I know how much exercise I can do within my aerobic range? Usually there is a formula that you can find on Google. If you Google and say, what is the rate? People will tell you, you you subtract your age from 220. So Ardelina is saying that she is 82 years old. So if you subtract 220 minus 80, that would be 140, right? So this means that for a person who is 80 years old, the maximum heart rate that the person can reach is 140. And then the aerobic and aerobic threshold is around 70% of that heart rate. So let's say, can someone give me your age here? Let's say you are, because I don't want to use the example of 80 years old because that is quite unusual. Let's say that you are 50 years of age, okay? So 220 minus 50, 170. And then what is 70% of the max? Because 170 is the maximum. So 70% you multiply by 0.7. So 70% of the maximum of a person that is 50 years of age is 119. So this means that if you start doing exercise and your heart rate will start increase because it needs your heart will need to pump more oxygen to your muscles. At around 119, 120 is when you start entering the zone of anaerobic exercise, which is good. If a person is healthy, they don't have fibromyalgia, they don't have chronic fatigue, they don't have post-viral syndrome, fine. You can train, you can practice exercise in the anaerobic range, which is what we consider vigorous exercise. For a short period of time, you're going to accumulate lactic acid, but that's fine. Your body will get rid of that lactic acid, which is that, why you also hurt after the exercise. But for people with fibromyalgia, chronic fatigue, post-viral syndromes, anyone who has central sensitization, you need to be within that range. So the range would be between 50% of the maximum to 70% of the maximum, okay? You are in that aerobic range. However, I don't like to use this formula because it varies from people to people. What I like to use, and then also you're doing the exercise and you have to measure your heart rate and you have to monitor your heart rate. No, don't worry about that. There is a much easier way for you to know if you are in the aerobic range. So practical. You don't need any equipment. If you can talk when you're doing the exercise, okay, but you're talking with difficulty, so you're doing exercise. Let's say that you're walking or you're biking, and you have a person with you, and you can still talk, but it's kind of hard for you to talk, because you are okay, but I can talk. I can still talk. You are in the aerobic range. If you can sing, so singing means that you can hold your breath, okay? If you can sing, you are not there yet. Now, when you pass to the anaerobic threshold, you cannot even talk anymore. You see that? So right now I can sing, because when you sing, you have to hold your breath. So I can sing, it means that I'm not even doing the moderate exercise. The moment that I start doing moderate exercise, I cannot sing anymore, but I can still talk to someone. The moment that I pass to the anaerobic threshold, I cannot talk, I cannot sing, I can only breathe. I cannot talk. Okay, so that's a tip. So the person who is, very limited in their physical activity, if you have fibromyalgia, chronic fatigue syndrome, if you have post-viral, post-COVID, and you have very severe fatigue, I want you to start doing this, even if you can do only 1 minute. Some people, they do 1 minute and then they start getting into the anaerobic phase. Stop. Don't try to go further. Do 1 minute, stop, rest. You need to be within that range. But then rest, and maybe 2 hours later, do another 1 minute and rest. And then another, maybe 3 times a day, 4 times a day, do that 1 minute of moderate exercise within the aerobic range, okay? Practice this. And then you will see that you will be able to increase. That's the exposure that I told you about. It's the same thing with the speaking public. The person who had fear of speaking public, you start speaking to 2 people. Now you talk to 5 people. Now you talk to 10 people. Now you talk to 50 people. And now you talk to an auditorium of 500 people. The person needs to increase. You need to be persistent with this, okay? The person needs to increase. Okay, from 1 minute, now next week, you're going to increase to 1.5 minutes or maybe 2 minutes. You will see that your body will adapt, but always within the aerobic range. Is that clear? That's my tip for you today. So I think I need to do a video about this, maybe to show with some figures and show on the screen. Probably I'll do that. But that's my tip for you. Let me see now if there are some questions here. I'll start from the last one. Gertie is saying, I have severe COPD and fibromyalgia. It's very difficult for me. Yes, COPD is chronic obstructive pulmonary disease, which means that the lungs have a disease, that there is a disease that they cannot change oxygen and carbon dioxide so well. So yes, I understand that. A person with COPD, talk to your doctor, but sometimes they need extra oxygen to do this exercise. Alfred, I have watched the brain retraining exercise video to reduce fear of pain. Yesterday, I did 29 kilometers bicycle ride, despite the pain. I'm so proud of you, Alfred. That's amazing. Gary is asking, low dose naltrexone. Thank you. That's an excellent question. I think I talk about that in my video of neuroinflammation. Yeah, I think I do that because we know that fibromyalgia affects many areas of the brain, and some researchers found that there are some markers of inflammation are higher in the brain of people with fibromyalgia. We don't know if that's the cause or if that's a consequence of fibromyalgia, but people have tried low-dose naltrexone. Naltrexone is a substance that blocks the opioid receptors, and it seems to help with low-dose naltrexone. So I talk about that in my video of neuroinflammation, and maybe I need to do a separate video. Gary, maybe I'll do a separate video only on low-dose naltrexone. The problem is the evidence is not so strong, and I had some patients that we tried. It's very expensive because you need to compound here in Canada, and they didn't have a lot of good results, unfortunately. Jane mentioned, do you want to mention the course Tanner has launched? I believe it's 20% right now. Jane, I don't have the link. If you want to put the link here in the chat, I will, let me see. I'll add you as a moderator, so then you can add things to the chat. Thank you. Let me see other questions. Can any of this cause headaches on one side of your head or neck? That's a good question. There was another question here too. There was another question that I read before about pain that starts in the neck and go to the head. That is more like myofascial pain. If you have never heard about myofascial, this is my book of myofascial pain. So it's a big book. There is a muscle, and one of the muscles is the trapezius muscle, that if I show you the picture, let me see if I can find the picture here of the trapezius. The pain from the trapezius radiates up to the head and can cause headaches. I can't find the muscle here now, sorry. But you see even some muscles here in the cover of the book, like this one here. This is the sternocleidomastoid, can cause pain radiating up the neck. the head. So sometimes when the person has only one side of the body, myofascial pain is a pain that is localized to a muscle group. And then you treat that muscle group, you eliminate the trigger points before it causes central sensitization. It's unfortunately, myofascial pain, because it's a muscle pain, it is a pain that is very associated with fear, because the person has this pain, nobody knows where it's coming from, they do x-rays, MRIs, nothing shows, so the person says, what is going on? So they have the fear of this pain, it's just muscle pain. And because of the fear, because the pain doesn't go away, then they may develop central sensitization. So we need to stop the myofascial pain before it becomes sensitized the brain. Let me see here. Other questions. Third degree burns. Can you answer my question? Sorry, I can't find. Okay. Are there any new treatments that look promising for fibromyalgia? I would say the best treatments that I've seen for fibromyalgia nowadays is not medications. Unfortunately, we tried, in the past, we tried pregabalin, duloxetine, amitriptyline, even opioids, tramadol, but we never got very good results. The best treatments that I have seen for fibromyalgia are lifestyle modifications. And these include taking care of your sleep, taking your sleep very seriously. Do everything you can to protect your sleep. Second, stop eating junk, stop smoking, stop alcohol. Third, exercise within those limits that I mentioned just a few minutes ago, the aerobic range. Third, then psychotherapy. Try to see if there are any fears, emotions, thoughts in your head. That's what Jane Planting, I hope she found the link to the course. That's what Pain Psychotherapy Canada, they have excellent psychotherapists there that will help you to see if there are thoughts, emotions inside of your head that are perpetuating that pain. Also treating trauma. A lot of people had adverse childhood trauma. They had trauma in their childhood or even adult trauma. It doesn't need to be a big trauma, like a trauma with a big T. It can be small trauma, micro trauma, bullying, stigma, fears, anger. This also causes sensations and emotions in the brain that perpetuate fibromyalgia. So those are the interventions that I find a lot helpful for fibromyalgia. So thank you for your question. Susan is asking, is anything for nerve pain? Yeah, so nerve pain is a different topic, Susan. It's neuropathic pain. Today, I didn't have a lot of time to talk about neuropathic. Maybe I need to do another live about neuropathic pain. Today is more about nociplastic pain, which is this malfunction of the pain system. Central sensitization is one of the mechanisms. Nerve pain is a completely different topic. It's neuropathic pain. There are a lot of other treatments. I have some videos, Susan, on my channel. What is neuropathic pain? I have one about what is the diet for nerve pain. I hope you can watch those videos there. I'm sorry, but I don't have a lot of time to discuss everything because it's a big, big topic. And Janina is saying, I was giving up life because my fibromyalgia pain. Oh, even considering applying for MAID in Canada. Oh my God, MAID, don't do that. And 2 months ago, I started low-dose naltrexone. My pain had gone from 10 to 2. I still have bad days, but quality of life has improved. I'm so glad to hear that, Janina. I'm happy to see that you are one of the people that respond well to low-dose naltrexone. Very good for you. Unfortunately, it doesn't help a lot of people, but I think it's worth trying. And I'm so happy that you are able to do this. And now maybe it's time to start, exposing your life to other fun things, exercises, and things that so many people give up when they have fibromyalgia. What about botulinum toxin? Joanne is asking for fibromyalgia. I don't recommend that, Joanne. Botulinum toxin is good when the person has spasticity, which is a disease of the control of the muscles, like people who had spinal cord injury, People had stroke, multiple sclerosis. They have what we call upper motor neuron or spasticity of the muscles. Botulinum toxin is great to relax those muscles. For fibromyalgia, if we do botulinum toxin, we'll be making the muscles weaker. I don't want the muscles weaker. I need the muscles strong. So I don't like to do that. And I had not had a lot of good results with botulinum toxin for fibromyalgia, but for other things, it's great. Shad Hamad, please, Dr. Furlan, don't forget my name, emailed. I don't respond to emails. Shad, unfortunately, I cannot respond to emails. You need to ask your doctor to refer you to TAPME. And TAPME is the Toronto Academic Pain Medicine Institute. They will screen all the referrals and see which doctors will end up seeing the patients. Okay, so we are getting close to 10 o'clock, and I don't want to drag this live too long. I'd like to thank everybody and remind everybody that I will do more lives like this. Stay tuned. You may subscribe to my channel so you will be notified when I will do more lives. I'm really sorry about the beginning of the live that I did something wrong with this microphone. I learned the lesson. Don't touch the microphone after the live has started. And if you are a healthcare professional, or if you're a doctor, if you have a doctor who is interested in learning about nociplastic pain, please tell them to take my course. And if you are a patient with chronic pain, fibromyalgia, chronic fatigue syndrome, post-viral, you can read my book. You can do the course that Pain Psychotherapy Canada has launched. Jane is putting the link there, and they have helped Jane a lot. So thank you very much for attending today. I hope you enjoyed this. Don't forget to give a like on this live here today, and I'll see you next time. Goodbye.